I'm an additional professor of neurosurgery in Nizam Institute of Medical Sciences, Hyderabad. I had the privilege of operating more than 8,000 brain and spine surgeries over a period of 10 years. I've been mentoring around 16 to 18 residents for past 10 years, writing research papers, as well as mentoring many students and giving global talks all over the world. The lessons, what I've learned throughout this career of 10 years, it's a very short span compared to the giants here, but whatever little I have known, the lessons I've learned not from the books, not from the textbooks, not from the conferences, but I learned most of the lessons from my failures, my patients, my OR, sometimes 30, 40 meters below the sea. So I'm going to take you all on a journey of my personal story, and let us begin. How many of you recognize this guy? So it was 2016, May 15th, after my 5 o'clock gym, had my breakfast, and rushed to the hospital in my peak traffic hours. I was listening to this guy. He's one of my favorite music band, Linkin Park. So the moment I was reaching the hospital, I was about to park my car. I got a call from one of my residents saying, Dr. Thirumal, Sister Caroline collapsed. Sister Caroline is a 35-year-old female who has been assisting in my OR for past 5-6 years. So the moment I heard that she collapsed, she's otherwise young, healthy young lady, and she was resuscitated and she was moved to the ER. And in the ER, again, they shifted to CT scan. The moment I went to the CT scan, I saw a motionless body of Sister Caroline, and she was barely breathing. Her GCS was very low, very low. You know GCS, right? So the moment I saw the scan, if you can see the scan, this is a normal CT scan. This is a normal CT scan, and you see the ventricles which are normal in size. But her CT scan showed enlarged ventricles with a tiny tumor or cyst within the brain. She had something called colloid cyst with acute hydrocephalus attack. And her pressure is mounting inside, her GCS is falling down, her pulse rate is falling down. Without intervention, she would have died in 5 to 10 minutes. The moment I saw, we made a burr hole, we made a small tiny hole into the brain, passed a tube into the ventricles and relieved the pressure. And in less than 5-10 minutes, she's up and she started talking normally. In the same evening, we operated the patient, removed the colloid cyst, and in 3 days, she got discharged back to her home. So the feeling on that day, the feeling of saving a patient, saving a human, you can say, from the clutches of death, saving a patient and human as well as a mother, giving back to her family, the feeling of giving back to her family, the feeling of feeling hope in place of despair, the feeling which was impossible to describe. And who wants to have, for that feeling, raise your hands, who wants to sacrifice their weekends? Who wants to have countless sleepless nights? Who wants to give years of blood, sweat, and tears? And who wants to become a neurosurgeon? So let me give you a brief introduction of neurosurgery. How it is different from neurology. As you know, human brain nervous system is more like a computer, and you can compare both of them, computer and human nervous system together. So what if your computer is lagging behind, or if a virus happened to your computer? What if a software engineer does? He doesn't open it. He gives commands or controls in such a way that he repairs it from outside only. He doesn't open it. Suppose one of you has spilled a coffee onto your laptop, or some circuit broke down. What a hardware engineer is going to do? He's going to open the computer, repair it, and keep it back. As a neurosurgeon, what we do is we repair it, open it, repair it, and keep it back. That's as simple as that. So what my typical workday looks like? The moment I go to the OR, or the moment I went to the hospital, if it's a clinic, outpatient clinic, then I listen to the patient. First is examination. As soon as you become the doctors, you sit in your clinic, first thing you do is listen to the patient. As Sir William Oslo says, listen to the patient carefully. He's telling you the diagnosis. So the moment you listen to the patient and ask relevant questions, you form a mental picture of what the patient is suffering from. Then what you do is you order sufficient investigations, you analyze those symptoms, you order relevant investigations, and then come to a diagnosis in better possible ways. And then you strategize what the patient is suffering from, you strategize the treatment plan, either with the patient requires conservative management or surgery, or what kind of surgery you offering to the patient. Then the most important thing, which we tend to miss in our medical career or medical school, is how to communicate with the patients. Before becoming a doctor, we become the humans first again. We sit with the patient, we become the fellow humans of the patient, we talk to the patient, we communicate in such a way that we feel some hope in it. Brain surgery, everyone gets really shocked. Everyone really gets scary when we are communicating with them that you're going to undergo brain surgery. You might need a brain surgery or spine surgery. It's really scary for them. You feel some hope, you feel some optimism in them so that they get themselves prepared for surgery, and you connect in a way where they build some trust and credibility in you. Then you prepare the patient for surgery and you prepare yourself for your surgery. You prepare your team for the surgery and you have a multidisciplinary interaction with the team, and all of you come to a plan and then discuss what you're going to do and what you're going to do if your plan doesn't go wrong, it doesn't go as per plan. Then execution. Execution is a part of surgery, is only a part of our life, and it involves various other factors like which we discussed before. And care is the post-operative care which we are going to offer. Every surgery is successful or failure depends on how better post-operative care you're going to offer. And evolution as a surgeon or physician, it depends on how much preparation you're making in your academic progress, by teaching, by attending conferences, by publishing research, or by attending people and conferences like this. So what you see is, can you have these lights off if possible? What you see is a scalp just got open. The scalp just got open. This is the scalp which got open, and you can see the skull, bare skull. So a skull is being drilled with a burr hole. Then those holes have been joined. They're slowly joining these bones. And what you see is the dura. Underneath the skull is the dura, which you immediately come across once you lift the bone. So depending on the pathology, you try opening the area which you require to the patient. So which we have seen the initial scan, the patient has been suffering from colloid cyst, as you can see. And the patient required opening of dura in that particular part. This is a fast forward video under this operating microscope, which you see here. And we are opening the interhemispheric fissure between two hemispheres of the brain. You can see a plane is being created in between the two corridors, two hemispheres, and corpus callosum is being opened, and will reach to the tumor. It is a very slow process, but for the want of time, I'm fast forwarding it. With this gentle dissection, you'll reach to the tumor and you'll remove the tumor. This is another patient of Moya Moya, as Dr. Ross was mentioning, a case of Moya Moya, where the child was suffering from repeated seizures, and the teachers and parents were thinking that he's falling asleep in the classroom. But upon evaluation, he found to have serial blood vessel narrowing, stenosis of those. This is a 1 mm blood vessel, and which is being required to be sutured to another vessel brought from the scalp, superficial temporal artery. This is my finger, and you can imagine the size of the 1 mm blood vessel, which requires suturing with this tiny thread, the nylon thread, and this is the superficial temporal artery which will be joined to this. After that, this is how it looks like. The superficial temporal artery is joined to the middle cerebral artery. And you'll confirm your suturing by your anastomosis by doing something called intraoperative ICG, intraoperative indigo cyan green study, that it's working well. You can remove the tumors not just by opening the skull, you can also remove the tumors by going through nose. This is the AI generated image, not a true replica. This is where anterocranial fossa, the cella suprasellar area, where you'll be reaching to the cella suprasellar area through the nose, and you'll be removing the tumor whenever drilling this bone. So this is after opening the cella. This is the dura which you'll see. And you'll understand the landmarks where exactly you are using a thing called neuronavigation. And you'll open the dura. The dura being opened slowly. And gently you dissect the tumor from the blood vessels, the anterior cerebral artery and the optic chiasm, and then gently you'll remove the tumor. So this is another colleague of mine who does regular deep brain surgeries to place the leads for the PD, Parkinson's disease, within the GPI, globus interna. What I specifically do is this endoscopic spine surgery. This is the prolapsed disc, and which will be removed. After the removal, you'll see this result, which was getting compressed here. The nerve root is freed now. And this is the nerve root, which is going through the foramen. And this is the disc fragment, which is prolapsed and is being gently removed. I'm rushing a bit since you're running out of time. These are the wounds through which the patient required 2-level discectomy. This is a tumor which is there in the foramen is being removed. This is a post-op scan. So neurosurgery and technology both are married to each other, you can say. Both are intermingled with each other. They cannot live without each other. Without technology, we are completely crippled. What I'm saying is you need not become a clinician if you don't want to become. There is always a scope for allied branches, allied sciences, which will, like neuroscientists or medical technologists, biomedical engineer, who you can club with them and you can develop many equipment which are not available at the moment. So I was able to do all these things because I've been trained by great teachers like Dr. Jogi and many more. And this, what you see is only the tip of iceberg, but there is a story behind my current state. Let me take you to 30, 40 years back. In my village, I was from a remote village in Telangana. It's a remote part of Hyderabad. It's a remote part of India. And this was me long before I was called a neurosurgeon or before I was called a doctor. I was known among all the class teachers for every reason, for every wrong reason. I was one of the most student who was always want to be outside. And I used to love climbing trees. I used to jump into the water irrespective if I know the swimming or not. After jumping in the midair, I used to think that someone was going to rescue me. And I was always used to be outside the class, and there was not even a single day I was not punished in the classroom. One day, I think it was 3rd or 4th grade, when I was in the 3rd or 4th grade, while we were sitting in our classroom, the fire alarm broke, fire alarm came. Every child was evacuated, everyone moved out, and the school building was burning. And all the children, 3rd and 4th grade children, were happily screaming that their school is burning down because they don't have to go to the school for at least 6 months more. I was sitting in one corner, I was sitting sadly, and one of my friends came and asked me, Thirumal, why are you so sad? Why are you sitting so sad? I said, all my class teachers came out, none of them are inside the classroom. So, so I was hating all the teachers. I was not a racist. I was hating everyone equally. I was completely hating everyone, and I was known for every wrong reason possible. But the moment I came home after playing at my place every day in the school, after playing around in the ground, the moment I came home, I used to see my mother being physically or verbally abused in a very severe domestic violence she used to face. And the problem, what I used to observe is there is the helplessness which I used to see. The mother which I was really dependent on is suffering from severe domestic violence. And I was a young boy who could not do anything but see in her helplessness. I used to ask her, Amma, what I can do? Amma means mother. Amma, what I can do to get you out of this pain? She used to say, there is nothing you can do to change in my family or my situation. All you can do is study well, become a good doctor, and help the poor and needy. That is what she kept on saying me over a period of years, I kept changing myself. Then from my village, I went to a town. I studied my +1, +2 pre-medical. I got a very good rank in MBBS, that is a medical school. I joined my medical school. Most of the times I used to spend my time in the library, unlike what I was in the childhood before. During my internship, after my MBBS, during my internship, there was a gynecology senior who is senior plus 2 years senior to me. She was one of the most beautiful girl in the class. Everyone used to admire her. So one day, to my utter shock, she came and she proposed to me. I was completely shocked. How did she propose to me? I had some hair back then, but how did you even propose to me? I was not a great looking guy. I was not a most handsome boy in the class, but I was shocked to the core. And I asked her, how did you even propose to me? She said, I have no reason. Then I gave her a shock of her life by saying no to her. Because I was already in love. I was already in love with the promise I made to my mother. I wanted to continue. I did not want any distraction possible. So I continued my course. Then I finished my MBBS, it's called MBBS, and MS General Surgery, MCH Neurosurgery. I continued my course, and I was this close to my dream of becoming a neurosurgeon. I was almost very, very happy the moment I got a good rank in neurosurgery and entrance in Nizam's Institute. I joined, and I was really, really excited that I'm going to operate on brain. The moment I entered the brain, again, the reality had given me a tight slap. The moment I entered the neurosurgery, it was really brutal. It was really, really harsh. Not just the long working hours or the operating times, not just the physical thing which you get drained out. It is emotional trauma which I used to face. I was again verbally abused, humiliated, singled out, and completely targeted, and I couldn't understand why I was receiving such a treatment. I used to try to endure for at least 3 to 4 months. I was already married, not to the same girl. I was already married, and I had a child, 8 months old child back then. Then I continued to endure the pain. I continued neurosurgery. At one point of time, I completely broke down. I said, this is not going to happen with me. I told my wife that I cannot do this neurosurgery anymore. I was at the lowest phase of my life. I was like completely devastated. I neither could continue my neurosurgery. Neither I could go back to my neurosurgery, nor I could stay back home because I have a family to feed. That was the darkest phase where I got the most important advice of my life. Somebody, my mentors, my friends, they said, whatever phase you are in, it is okay. This situation is common. This situation is for everyone. But take a moment, take a pause, and reflect what your situation is like. And then decide whether to go ahead with neurosurgery or discontinue neurosurgery and stay back with your general surgery and continue your general surgery career. That was the most important path where I have to move this way or continuing, or this way or discontinuing. I had taken 2 to 3 months of leave. I reflected upon myself and tried to understand the situations. I tried to imagine what the situation they're like, why they are behaving like that. Then I came to understanding that nothing is going to change there. The people won't change, the situation won't change, the things won't change. All I need is a change in me. The perspective in me had to change. So I went back with a different perspective, all because I did not fight my fight alone. I always sought help. I always approached people who are ready to help me. In your career also, you'll face so many challenges, so many hardships, but everyone in your family, everyone, your friends and mentors, teachers, they want you to grow. They're ready to help you. And I tell you, never fight your fight alone. Let others fight along with you. Let others also suffer with you. So the best decision I made is not quitting. I continued my neurosurgery. I joined back the same ward, same duties, but not as the same person. So I continued my neurosurgery and had never had to look back. I did thousands of brain surgeries, did my endoscopic spine fellowship, publications, and many, many talks across the world. This is American Association of Neurological Surgeon membership, and many talks I've given. This is my mentor in South Korea, and many newspaper publications, media coverage was there. I'm skipping all these things because of want of time. So this is one thing which you have to face, which you have to understand, that India and USA have two things in common and many things in different. India has a population of 1.4 billion patients, and the workload which you see, the doctors there you see is enormous. The patient exposure is too high, and we are very mindful of our resources, and cost-conscious care is there not at the cost of quality. And very easily, the doctors can adapt to situations and bring out the best of the best. In the other hand, USA has great research team, and you are the masters of innovation and multidisciplinary care and highest standard of patient care you will be offering. So why do you have to cross the ocean? Because if you have an exposure of not just India, any other country, I advise you to go to some other country and observe their medical system to get a different perspective of how the medical system is there, how the treatment is being offered, what kind of diseases they are being treated, how they are coming out with equal results with least amount of resources possible. So like this, some of your students, Sierra is there and Bach is there. Many of them have come, 8 students have come to India to spend a week time with me. This skeleton's name is Lucy. She's our friend. And this is what we've been spending a week time learning in the OR. They are here after seeing the spine fixation. And these are the team who came here. We went out, we had a lot of fun, and you can see Sierra is also doing the aerial yoga thing. She was the master at it. That was very fun journey what they had there. So was neurosurgery my whole life? No. As I was telling you, neurosurgery is a part of my life, and being in water was always the most passionate about. I was very passionate about. So this is a recent video where I dived in Philippines. After my talk, I went dive into the Philippines. There I did my 41 first dive, where I finished my advanced open water nitrox course. This is a night dive which we did here in Key West last year. This is a stingrays you can see. This is my advanced open water certification. So why I liked neurosurgery and scuba diving both is because both requires pre-operative planning. We have a lot of planning, and if you're panicky, it kills you. If you're panicky, the patient can die. So these are my mother and my wife because of whom I'm here. 90% of my life is because of them. My beautiful daughters. Finally, I just want to say, I don't want to say that you want to become a neurosurgeon or cardiologist or anything. You can become anything you want. All I want to tell you is you find your calling. What exactly is your passion about? What exactly you're making your Monday mornings beautiful? What excites you to the most? What makes you forget the time? So once you find your passion, once you find your highest passion, then commit to it. Set your goals high, commit to it as much as possible, give your everything to it. You give your time, discipline, energy. And in that process, I'm telling you again, you will fail many times, you will fall many times. But in that situations of hardship, in that situation of uncertainty, take a pause, reflect upon the situation. Again, go back to your friends, seek help, and become completely what you want to become again. Thank you so much. Just attribute to the greatest mountaineer ever, Nims Pujara, who recently died in the avalanche. So I like this quote, giving up is not in my blood, son, not in my blood. How many of you know this guy? Okay, thank you so much.
Thank you, Dr. Thirumal. You did exactly what we hoped, and you hit the mark. On the first week of school, we needed a lecture not about anatomy and pathways and all that, something inspiring, something to make us think of who we're going to be and who we are. And I did forget to mention, of all the neurosurgeons I've met, thousands and thousands, you're the only person that does scuba diving, and he does it seriously. I think we do have some time for questions. Is that okay with you, sir? Please, why don't you run the microphone to anybody who has a question? Please just, anybody who has a question there? Go ahead. Introduce yourself.
Hello, my name's Nerium. I'm a M1 here, first week and everything.
Where are you?
Right here.
Okay.
Yeah. My question was, you mentioned that you went to, or you come to America and practiced here and in South Korea. So my question is, what motivated you to pursue global medicine as opposed to mainly practicing in India?
Sorry, you must have got wrong impression. I'm not practicing in USA. I just came for a program here as a scientist in residence program at the India Center. But to answer your question, global perspective is very, very important. As I was mentioning, you will understand how for the same problem there are multiple routes. For the same problem, you'll find different approaches, and you'll know which many perspectives of many surgeons or many physicians to the same problem. That is what gives you a different perspective of different facets of a single thing. That is in summary. Yeah.
Thank you.
Friends, I'd be remiss if I didn't mention Dr. Nizam Razak, neurosurgeon par excellence, chairman of the department, now running for office. Nizam, did you want to say anything to Dr. Thirumal?
Puts me on the spot. I remember when I was in medical school, I was a second-year medical student. I was actually an MD PhD student, and I wanted to be a radiologist when I started medical school because I wanted to work 9 to 5. That's what I did. So I was downstairs, and back then they had all X-ray view boxes in the basement of the hospital, looking at films with the radiologist. And the neurosurgeon comes down, starts screaming at the radiologist, said, "Hey, you F this read up. How could you do this?" Da, da, da. And then points at me and goes, "You, student, come with me." And I'm like shaking. And the radiologist goes, "Just go, just go." And I go, "This guy just sacrificed me to this neurosurgeon." So I go upstairs, and it was a posterior fossa tumor. And I was very quiet, and everything got calm, just like you said with the scuba diving. Everything got calm, and that was the coolest thing I ever saw. I quit my PhD, and I went neurosurgery full blast. That's why I chose neurosurgery. Thank you. Keep your minds open. That's what I'm saying.
Yeah, hi. Good afternoon. I'm Beniaz. I'm from Hyderabad. So right now I'm at UCF College of Sciences and Department of Physics. I want to ask a question from the human perspective. You must have encountered a lot of patients and you have seen their mental agony. So how would you like to handle this one? Because the family of the patient, they also go through the same suffering. Yes.
That's a really tough question to ask, because surgery is something which we are taught in the medical school, but to handle patient emotions, to handle our own emotions is really difficult. Suppose if I'm operating on a child, which I get sometimes emotionally get bonded to, we get nightmares before surgery. And there is something called second victim syndrome. The amount of pain and suffering the family goes through, this patient goes through, the surgeon and the treating team also goes through. We sometimes have to be, I don't know how to say this, we sometimes have to become cold-hearted. We need not carry those emotions home. Otherwise, you cannot even get the sleep. You will not be able to sleep at all. It's really difficult, but somehow you have to bear through the pain and feel their pain and give your best whatever you can. And don't expect the results that he'll be completely out of, because neurosurgery is totally unforgiving. Like any other dangerous disease, medical oncology or anything, neurosurgery is many times unforgiving to surgeons as well, as Dr. Jogi says.
She has a question that I'd like for the students to speak. If possible, Sierra and Bach and anybody else, please.
Oh, I'm a guest. Is it okay then? Okay. Thank you, Dr. Thirumal. Though the smell of food, all the flavors, they are pulling me back there. But then I wanted to listen to your lecture more than having food. Being this AI era, I wanted to ask how much of neurosurgery would be replaced by humanoids in future? And I have another question. It's okay if you would like to answer it now or later, but you have done so many surgeries, as you said. Which one was the most toughest and why?
First, every surgery is tough to me. every surgery is equally challenging. Every surgery is, there is nothing like simple surgery or complex surgery, or nor it's the amount of duration, the time it takes. The first slide I've shown a nurse whom I operated upon. That is a 5 minutes procedure. Sometimes you must have operated 12, 13 hours. So it's not the duration. Every surgery is dependent on patient's life. Every surgery is equally tough. Every surgery is equally easy, you can say, as you grow experience. Second thing is, I'm not sure about the humanoids will replace surgeons yet, but there is always a human element, irrespective of any amount of robots come. Always humans will use their conscience and humans will rule. That is what I believe. I don't know the future, how it's going to be.
Hi guys, my name is Sierra and this is Bach.
Hello.
We went on the India winter break trip last year. I think one of the big things I took away from it is you hear before you go, you know, India has such a great case volume. You're going to see so many more different types of things, but actually experiencing it was a whole nother world. Basically woke up in the mornings and I shouted at NIMS. I also did the majority of my times at KIMS while I was there. Wake up in the morning, you see 4 or 5 different surgeries. There's a bunch of different surgeries going on at the floor at all times, all different types of things. Then as soon as they're done with surgeries, maybe like 4 or 5 p.m., then they go to the main part of the hospital and they're seeing more patients. They're seeing people in clinic who came in that day who need help. The dedication and the time commitment that they put into every patient was truly inspiring. And we were, you know, when we were looking at the clinical part of it, we were literally hopping room from room. People were lined up waiting, and they would see everyone they could that day. And it was just truly inspiring to see that kind of case volume and the kind of dedication it really took. And yeah, I absolutely loved it. I got so much out of that trip, not only about neurosurgery and very cool procedures I got to see, but also what it means to be a truly dedicated physician and put your patients first. So I'm very grateful.
Wow, I have to follow up for that. And from my perspective, a little different because I'm mostly focused on emergency medicine. So because I understand today we're talking about neurosurgery, but we're also talking about global medicine. And one of the things that we want to talk about global medicine is how to decrease mortality rate in both infancy as well as for maternal death following childbirth. And through this program in GOK EMRI is now called Green Health, is the ambulance program that allows the pregnant woman to receive the care on the way, as well as receive a faster care through that deployment system. And this is something that I was really hoping to employ in the US. So I'm strongly encourage everyone to take a look at how other countries using logistics to solve the problem and how we can learn from that.
Okay. Yes, I'm Dr. Ferdowsi from UCF College of Health Professions and Sciences. Thank you so much for coming, and thank you for the nice presentation and wonderful journey to the neurosurgery. I want to echo her question regarding AI. These days, you know that AI is every place. So I just want to see and have your advice to a student regarding the use of AI and how AI can affect in neurosurgery. And also, I just wondering how robotic surgery can go to the neurosurgery, and is anything that you can do it or you did it before? Thank you.
Already there in neurosurgery, and robotics are currently placing the leads or placing the screws within the brain. You've seen deep brain stimulation surgery, leads are being placed at a sub-millimeter accuracy. But all this planning is done by the humans as of now. But in planning, in future, as the robots get smarter and smarter, the planning also might be done by the robots. But final approval, final judgment lies with the doctor himself. The final approval is never given to the patient, never given to the AI robot completely. And because we haven't figured out what if AI makes mistakes, whom to be blamed. The explainability is not yet discovered. We don't know how the AI will function, and if it makes any mistakes, we don't know whom to blame. The regulations are not clear yet. So in future, in the AI will model for us, AI will plan for us, but final validation will be done by the, at least in my generation, I'm 41 years old, at least by the time I'm 60 or 70, I still feel that humans are the final judgment, givers, takers of the surgery or anything, but AI might help us, but it's not going to replace us.
Oh, here we go. My question is regarding just global health in general, as you're able to learn from different countries and bring it back to your own or vice versa. How can we continue to be doing that while still acknowledging and respecting cultural differences and just the differing societal structures between countries?
The moment you go to different hospital, the moment you come to India, you'll be accompanied by a team of doctors and you get to understand how the treatment is being done, how they are speaking to the patients, how they are communicating with them, how they are examining. The cultural differences are always there, but the human language and the way we approach to the patient is always the same. The moment you see the patient, you try to establish a bond. Have you seen this movie called Patch Adams? Any of you? In that, he says, Robbie Williams says, you don't call the patient by his disease. If the patient of glioblastoma is lying there, you don't call the patient by disease. You call him Mr. Rob. And that is where you establish a bond. The moment the patient steps into your clinic, you establish a bond by calling by his name. You're looking into his eyes. You're tapping while you're doing your rounds. That is the universal language, irrespective of cultural barriers. That is what how you establish a connection with the patient. Thank you.
Dr. Thirumal, thank you so much for coming and spending your time with us. Friends, I know some of you didn't get your food because we had to start on time. I believe the food is still there. Please go get some food so you can go to your next class. We do this every year, thanks to Dr. Verduin, Dr. Deb German, and the UCF India Center and generous donors. We're going to be doing this every year, usually in the first week of school. Pass this on. But most importantly, the lessons from Dr. Thirumal about life, how to be a good doctor, not just writing on the board like Deb German did, Dean German did the other day, and you guys did. Practice it. Practice it. I was in your chairs 1977 in Texas, and I'm very fortunate that things I've learned, he repeated today. Take them home, make them yours, and we'll be studying together. I'll be seeing you guys later on this year. Thank you all for coming.